Hi there, Dr. Michael Moore, Advanced Women's Health Institute. We are celebrating Endometriosis Awareness Month this month. This is first of 3 Tuesday night talks, and we'd like to kind of talk about endometriosis because it causes a lot of pain, a lot of problems. So what is endometriosis? Got to start back with the uterus is a big muscle, and that's where the fibroid tumors come from, the muscle of the uterus. But inside the uterus is a cavity, and that cavity where the baby implants is lined with tissue that we call the endometrium. So each month you're building up your uterine lining, your endometrium is thickening. Each month when you have your period, you're shedding that endometrium, you see the flow that comes out the vagina. But what you don't see is, as a woman, you don't see the retrograde menstrual flow. So menstrual flow goes back through the fallopian tubes, that bloody fluid ends up in the pelvis, your immune system is supposed to clean it out. Now, why do women get endometriosis? Tissue implants outside the uterus that look like the endometrium. So it has the glands and all the other features of the endometrium, but it's totally outside the uterus. So it's not in the uterine cavity, it's outside the uterus, and they call it endometriosis. Now endometriosis has been described in a lot of places outside the pelvis, but these are very unusual. The vast majority of endometriosis is confined to the pelvis. So reports of women who cough up blood each month at the time of their menstrual period are highly unusual, but we know that deeply infiltrating endometriosis can occur. It can grow into the bowel, it can grow into the bladder. There have been reports of endometriosis being found in the brain. Very interesting stuff, but at the same time, it doesn't happen very often. So don't worry if you've got endometriosis, that's probably not going to happen to you. What does happen with endometriosis is primarily a lot of pain. Women come in talking about how their menstrual cramps are getting worse. They're getting more painful. They talk about how it's painful to have sex now. It's like there's cramping pain with sex, or after sex there's cramping pain. And they start having pain in between periods. Like, I used to have cramps, with the first couple of 3 days of my period. Now I'm having cramps for a week before my period, and the cramps with my period are twice as bad as they used to be. So worsening pain issues are what kind of triggers to thinking about endometriosis. So if your cramps are getting worse, regardless of your age, you need an evaluation for endometriosis. Don't just accept it's your age. That kind of stuff happens, which is very common in a rushed practice. The doctors rush, they're in and out as fast as they can. You're saying, hey, I got these worsening pains, and unfortunately sometimes what they do is they just kind of brush you off with, oh yeah, that's your age. When I was in training, it was pretty much taught teenage women don't have endometriosis, and now we know that that's not true anymore either. So when young women have a whole lot of pain, we have to take them seriously. We have to think that they have endometriosis. Especially when a woman is, at any age, complains of worsening pain, we think of endometriosis. So what causes endometriosis? Why do women have it? Boy, if I knew, I would be really happy because I'd probably have won a prize. But no, nobody knows what causes endometriosis. There's theories, there's lots of theories. One is that retrograde menstrual flow, when those cells go back into the pelvis, that those cells actually can attach to the lining of the pelvis, and that can then cause as they attach, kind of like you see in the springtime, the cottonwood blows around, and those seeds attach somewhere on the ground, and sometimes they turn into cottonwood trees. Except endometriosis is kind of more like weeds, I think. And so if those cells implant and they start proliferating into implants of endometriosis, they can cause pain. Some people think it's the fluid itself that causes cellular changes. Now, I think a lot of us know about stem cells, and it's very popular these days, especially like if you've got arthritis or your joints hurt, to get stem cell injections, and it's maybe going to cure you. It costs a lot of money, and it may not. So some people think that menstrual fluid has within it certain chemical compounds, and as those chemical compounds stimulate the cells. So as that fluid kind of bathes over the tissues, that stimulates cells to change, cells that already have some potential to change. Some people think maybe it's pre-programmed, that there are cells that are going to turn into endometriosis cells no matter what. People who kind of think about that theory, they think about endometriosis being identified in fetal autopsy tissue. A woman has a fetal loss. Everybody wants to know why. The doctor, the pathology doctors perform an autopsy to try and help the couple figure out why. And in that autopsy, there have been reports of endometriosis being found in fetuses. So we still don't really know what the cause is. But it's a fairly common thing. About 10 to 15% of women in our population are affected by endometriosis. We think it tends to run in families. It tends to also correlate highly with Caucasian women who are high income and high education. I'm not sure exactly why. These are just studies that have been done trying to give us an understanding of who gets endometriosis. But I think any woman complaining of worsening pain should be considered a possible patient who has endometriosis. Not all patients that have pain have endometriosis. And then it's the question of, what do we do about